Hi everybody, welcome to Game Day. This is Adam and Brendan here to show you about subcutaneous injections. The three things that you're going to need for your injection are going to be your medication, you're going to need a syringe, and you're going to need some alcohol. First step in this process is you want to wash your hands. After washing your hands, you're going to get your vial of whatever substance you're going to be injecting. You're going to pop off the cap, snap, there goes the cap. Never assume that this is clean, okay? So you want to scrub that off with some alcohol vigorously and let that dry. The next thing you're going to do, you're going to pick up your syringe, and there's two caps on. One is for the plunger, one is for the needle. You're going to remove the plunger cap. The next thing you're going to do is remove the needle cap. You can either stand this up on your tray or on your clean surface, or you can lay it down to scoop up so you can recap your needle without sticking yourself, okay? You're going to fill up your syringe with air, like so. You're going to then insert the top of the needle into the rubber stopper and inject the air. Invert, and you can use, I like to use the approach where I incorporate my fingers because it adds stability, okay? So if you look how I'm holding the syringe and I'm supporting it with my fingers here, and I'm going to then withdraw however much I would like to inject, whatever is prescribed. So I'm going to draw this much here, and I'm going to gently flick the syringe while stabilizing the bottle to get any air out. Any air bubbles that float to the top, I'm going to push that air out back into the vial, okay? Once I have the dose, I'm going to remove the needle and set down the medication, and I have my dose right here, okay? If you still have some air, you want to try to get it out, you can try back on the plunger and vigorously kind of flick at it until all those air bubbles rise to the surface. Then you can gently squeeze on the plunger until a little drop gets to the top of the needle, okay? Then you're all prepared to do your injection. So I'm just going to do the scoop method to recap my needle because I'm going to hand this over to Brendan, but in real life you would just inject yourself. So Brendan's going to describe how to inject.
All right. Now that I have my injection with my medication, I'm going to set this down for a second. You're going to find the area that you want to use. Typically for subcutaneous tissue, we want to work around the belly button and then out to the flanks. For me, I tend to go right about here. You're going to want to grab another alcohol swab that is clean. Open it. Pick your area. Wipe it down. Now the cleaning action of the alcohol, you want it to dry before you do your injection because that is what sterilizes the area. Once it's done, you're going to squeeze, pop this off. You can pop your cap off. Squeeze,